Subcommittee will come to order. Chair will recognize himself for 3 minutes for an opening statement. This subcommittee has held 2 hearings on the class program this year. The first hearing was on March 17, 2011, and the most recent hearing was on October 26, 2011, after the Department of Health and Human Services announced it was not moving forward with the implementation of the class program, quote, at this time, end quote. Even before its inclusion in the President's health care law in March of 2010, we were warned by the administration's own actuary, the American Academy of Actuaries, and members of Congress from both parties and outside experts that the program would not be fiscally sustainable. However, under a convenient budgetary gimmick, the class program accounted for nearly half of the savings that proponents claimed Obamacare would produce. During our last hearing, Assistant Secretary Greenlee testified that HHS had spent $5 million in 2010 and 2011 trying to implement the program. By November 14, 2011, after determining that the class program could not meet the law's 75-year solvency requirement, the Department finally admitted what nearly everyone already knew: the class program was not sustainable and it could not be made so. The intent behind the class program, a voluntary program for long-term care insurance, was laudable. Only about 9 million Americans purchase long-term care insurance, and yet most of us will end up needing it. Crushing medical costs are leading people to bankruptcy courts and already overburdened Medicaid rolls. Good intentions, however, do not make up for fundamentally flawed, actuarially unsound policies designed to show the illusion of savings. During our October hearing, several of my colleagues seemed to be saying that if you believe there is a long-term care problem in this country and you want to be part of the solution, then you must defend the class program. They also implied that if you don't defend the class program, then you must either want people to suffer under the crushing weight of medical bills and inevitable poverty, or you simply don't care one way or the other if they do. That is a false choice and a premise that I refuse to accept. Supporting repeal of the class program is not denying the existence of a very significant problem facing millions of Americans, nor is it a show of apathy towards those who are suffering. There are many of us who want to tackle the long-term care situation in our country that our country faces, but we realize that class is not the way to do it. The Department of Health and Human Services has stopped attempts to implement this program. However, it is difficult to imagine a more vibrant private sector long-term care insurance market if the prospects of a government-run program remains. Our subcommittee should support H.R. 1173, the Fiscal Responsibility and Retirement Security Act of 2011, which will officially repeal the class program, and then move on to discuss real solutions to this problem. The subcommittee will take up long-term care again, and I look forward to working with my friends on both sides of the aisle on this issue. I now recognize my friend from New Jersey, Mr. Pallone, for 3 minutes for his opening statement.
Thank you, Mr. Chairman. I'm opposed to H.R. 1173 because it's a giant step backwards towards addressing the long-term care crisis in this country. When this subcommittee last convened, I expressed my disappointment with the administration for abandoning the class program. Today, my disappointment is solely directed towards my Republican colleagues that seek to repeal the class program and in turn have failed to offer any real solutions for long-term care access in America. I understand, Mr. Chairman, I listened to what you said. You're saying, well, we can repeal this and then we'll come up with something else. I don't believe that that will happen, as much as I understand you would try, but I don't see that happening. My problem is that, I think that my Republican colleagues continue with this attitude that, Congress can't do anything. And that's not what the American people want to hear. Repeal of class is both dangerous and premature. Current law provides a structured framework that allows for a reasonable long-term care insurance program that helps people plan for their eventual long-term care needs. We simply have to convince the administration to try the implementation. A path was outlined with their actuary that the department hired. This Congress must continue to work towards addressing a workable solution to implement class in a fiscally sound manner. And that's why I'm advocating for HHS to convene the Class Independence Advisory Council. The expertise of this council is critical to informing Congress and have HHS move forward on class. American families have too few long-term care options, and they need our help. I say to my Republican friends, running away from the problem through repeal is not the answer, and that is why I will not give up on class. In fact, my Democratic colleagues and I will offer a number of amendments at full committee to block repeal of the class program. Let me just close by saying this. I'm kind of tired of wasting Congress's valuable time with haphazard repeal bills. This is not the first. We've had many efforts to repeal different aspects of the Affordable Care Act. I think it's just a waste of time. Class can be implemented in a meaningful way if everyone merely tried. We need to have a can-do attitude in this committee. Congress can do things. The Republicans have a negative attitude that Washington can't do anything, and I just don't understand it. Moving forward with class is a realistic solution that has the promise of making a difference in the lives of many Americans. Let's keep it on the books. Let's try a way to implement it. Let's try to be positive about what we can do. I'm certainly open to other means of implementation, talk and have hearings or have discussions about ways of implementing class. But repealing at this point accomplishes nothing other than to send a very negative message to the disabled community and those who were supportive of trying to come up with a long-term care solution. There's nothing accomplished with repeal, Mr. Chairman.
Chair thanks the gentleman and now recognizes the Chair Emeritus of the full committee, Mr. Barton, for 3 minutes for his opening statement.
Thank you, Mr. Chairman. I'm going to submit my opening statement for the record. I won't take the entire 3 minutes, but I do appreciate having it. I support repeal. I think the chairman and full committee chairman are right to put this bill before this subcommittee and then the full committee. Having said that, we do have a problem in America that needs to be addressed, and I was gratified to hear the subcommittee chairman state that he wishes to do something about long-term health care. Each member of Congress pays the maximum each month in Social Security taxes until we reach the cap, which is about $800 per month for the first, I think, 8 or 9 months of the year. It would seem to me that at some point in time, perhaps we could take a small portion of the taxes that we're already paying and at least give people the option to put some of that into a long-term health care plan so that we have some long-term health care option for our citizens. We all know that Medicaid, which is designed for indigent health care, spends more money on long-term health care than it does on actual health care. So we do need to solve this problem. The Class Act is not the way to solve it, so it's, I will say, to the benefit of those that supported the Class Act when it was implemented. I did not, but at least they put in a provision that the program had to be solvent. And again, the actuaries at HHS have determined that it cannot be solvent. So the thing to do is to repeal this program and then hopefully work together on a bipartisan basis to come up with something different that does work. With that, Mr. Chairman, thank you for your leadership, and I yield back.
Chair thanks the gentleman and now recognize the gentleman from New York, Mr. Towns, for 2 minutes for opening statement.
Thank you very much, Mr. Chairman. Let me thank you, Chairman Pitts and Ranking Member Pallone. The issue before us today is of crucial importance to millions of Americans who need long-term care, and they need it now, or will be in need of it in the future. The absence of affordable long-term health care options is a major burden on individuals and their families, as well as our government. Under this status quo, seniors or disabled citizens in need of long-term care can only get financial assistance once they have spent their savings and become eligible for Medicaid. In New York, AARP recently reported that the median annual nursing home private pay costs in 2010 amounted to 393% of median household income for those over 65. We can all see this is unacceptable. With more and more of us living longer and requiring long-term care, the number of seniors driven into poverty and in need of Medicaid will substantially increase. In New York alone, by 2015, the number of people 65 and older with functional impairments is projected to grow by 17.1%. A growing portion of those impaired will be elderly minorities who are especially at risk of requiring long-term care assistance. Within less than 5 years, there may be as many as 690,000 people who require long-term service in home and community-based settings. An additional 160,000 will be living in nursing homes or group care facilities. In the context of these figures, it is clear the cost of health care to the government will become a massive burden. Repealing class without an alternative simply allows an unsustainable status quo to continue and does nothing to solve the problem we are facing. To that end, Mr. Chairman, I plan to offer an amendment during full committee markup that ensures that we do not repeal class before being certain that there is a suitable alternate option in place. Instead of repealing it outright, we should all work together to figure out how we can make long-term care a reality. Let's show that we can do something that the most of the committees around here have not done, and that is work together to improve the quality of life for people. On that note, I yield back.
Sure. Thanks, gentlemen, and recognizes the gentleman from Illinois, Mr. Shemkus, for 2 minutes for an opening statement.
I don't have an opening statement, Mr. Chairman.
The gentleman from Pennsylvania, Dr. Murphy, is recognized for 2 minutes.
Thank you, Mr. Chairman. And as a co-sponsor of this legislation, I'm pleased we're having this markup today. As I've said on many occasions, if any insurance company began collecting premiums, held onto them or spent them for several years, and then tried to spend that $86 billion before paying out a single penny in benefits, it would rightly be prosecuted. Such Ponzi schemes are illegal in this country. The administration knew this program was not sustainable. They knew that it would do nothing to address the issue of long-term care insurance, but it was included in the health care bill anyways because it provided a false veil of savings for them to hide behind. Now Secretary Sebelius admits the program is totally unsustainable and the promised savings have evaporated. This is another example of how the health care law puts perception and politics ahead of real policy and really taking care of what our citizens need. What people want is affordable and accessible health care and not more costs. What Americans want is lower costs and less taxes. What they have is a plan that raises both. What Americans want is less debt and less deficit. The Class Act increases both. Job creators want to be able to lower their costs to create more jobs. This adds to their costs. Americans want us to fix the broken government programs that already are in place, not to create another broken program. They want us to eliminate waste, fraud, and abuse in Medicare and Medicaid and reform the ways that those plans manage chronic illness that can reduce costs dramatically. We've not done those things, and instead this offer of a new program that's going to increase costs and not provide the solutions is basically what Americans are saying. It is not time to do this. We don't need to add more to our deficit and more to promises and more to reducing jobs. And with that, I yield back.
Chair, thanks, gentlemen, and now recognizes the gentleman from California, the ranking member of the full committee, Mr. Waxman, for 3 minutes for his opening statement.
Thank you, Mr. Chairman. Today, Republicans on this subcommittee will vote to tear down the only framework we have in place to begin to address the nation's long-term care crisis. The CLASS program is an important effort to provide assistance to elderly and the disabled who need help with daily living. This voluntary, privately financed insurance program is designed to allow the elderly and disabled to live independently, to stay out of institutions and in their homes. And for those who are no longer able to be on their own, the program also can assist with the astronomical cost of nursing home care. CLASS is not perfect, but rather than working with us and with Secretary Sebelius, House Republicans want to throw out CLASS altogether and replace it with absolutely nothing. Their plan is to keep the status quo. House Republicans would have our most vulnerable citizens and their families continue to believe that Medicare is the answer, when in fact that program covers only minimal and short-term long-term care needs. They would push private long-term care policies, even though these policies are often too expensive or difficult to purchase. and don't always cover the services that are needed when they are needed. That is why less than 10% of the population holds these policies. House Republicans would watch the elderly and disabled spend down into poverty so they can qualify for Medicaid coverage to pay for their long-term care and supports. At the same time, they would turn their backs on both the states and the federal government as they struggle with ever rising costs of long-term care under Medicaid. The price tag for these services in 2010 alone was some $120 billion. We simply cannot persist in relying on this patchwork of options, not when 25 million Americans will be in need of such services by 2020, and not when long-term care is draining our Medicaid resources. Instead, we should maintain the framework that class provides for moving forward to achieve the goal we should all share, ensuring that Americans who require long-term care and support services are able to get them what they need when they need it. Regrettably, the H.R. 1173 does just the opposite. It does not fix, it just repeals. Once again, there are no answers from House Republicans and no solutions. Once again, they set us back in our long struggle to deal with this terribly complex and difficult challenge. For these reasons and more, I urge my colleagues to reject H.R. 1173.
Chair thanks the gentleman and recognize the chair of the full committee, Mr. Upton, for 3 minutes for opening statement.
Well, thank you, Mr. Chairman. It has been 2 years since the Class Act was first debated as part of the President's health care reform plan. American taxpayers deserve to know about the concerns that went largely ignored by the Democratic leadership in both chambers in an attempt to rush through the President's health care bill. The truth is that outside analysts, such as the American Academy of Actuaries, raised concerns with this program as early as July of 2009, 5 months before the President's plan was even considered on the Senate floor. During the health care reform debate, members from both sides of the aisle also raised concern about the program's long-term sustainability. Then earlier this year, a bicameral investigation revealed that concerns from within HHS were rampant during the health care debate, but never brought to light by the Democrats' leadership or the administration itself. Those concerns all came to a head about a month ago on October 14th, when Secretary Sebelius announced what honest accounting told us was inevitable. The administration finally admitted that there was no viable path forward and therefore was halting further implementation of the class program. The failure of HHS to implement the class program is not a surprise. It really isn't. However, it is a catastrophic consequence of what happens when Congress rushes to enact costly policies and dismisses warnings from independent experts. Most troubling are the budget gimmicks used to sell the class program, indeed the entire law. CBO, using strict rules about how to project costs in a limited window of time, estimated the class program would save money by collecting premiums from enrollees, premiums that will now never be collected in light of a failed implementation. We knew the savings for the President's health care plan were wrong. We did. It defied common sense that such a massive spending expansion would not have a cost. Now, more than a year later, the President will have to explain to the American people why the health care law will cost them $80 billion more than they were told. $80 billion on top of the trillions the President has added to the books since he took office 3 years ago. Today we'll have an opportunity to start over on a long-term care reform, an issue that is important to all of us as we hear from constituents regularly about the growing cost of long-term care services. We'll begin that process, but first we must take class off the books. Thanks, Mr. Chairman, for holding this markup today. I urge my colleagues to support the bill to repeal a program that does not work and we cannot afford. I yield back.
Chair, thanks, gentlemen. Now recognize the ranking member emeritus, gentleman from Michigan, Mr. Dingell. 3 minutes for opening statement.
Mr. Chairman, I thank you for your courtesy. As this subcommittee heard just a few weeks ago from Assistant Secretary Greenlee and Assistant Secretary Gleed, HHS has determined that the Class Act is unworkable at this time. Assistant Secretary Greenlee also committed at the hearing to working with the Congress, industry, and consumers to explore options for affordable long-term care insurance for Americans, a desperate need for millions of Americans. Like other members of this subcommittee, I am disappointed that HHS is not moving forward with the Class Act. However, I cannot in good conscience support repealing the Class Act when we have no viable alternative for affordable long-term care, and when we could be working on making this legislation into something that will in fact work to benefit the United States and its people. Repealing the Class Act does nothing to address the fact that private long-term care insurance options are limited and the costs are too burdensome for many American families. The Class Act was designed to fill an unmet need in our society, a desperate need that will not disappear with repeal, to provide an affordable long-term care option for the 10 million Americans in need of long-term care now and the projected 15 million Americans that will need long-term care by 2020. We must leave the framework in place if we are to be able to work effectively to solve a problem that plagues, as I've mentioned, some 10 to 15 million Americans. And we have to try and see to it that HHS and others can find a way to make the Class Act or another long-term care program work. We cannot and we must not allow Medicaid to continue to be the only affordable long-term care service available to Americans. That program is causing substantial financial difficulty to the American people, to the states, and to the federal government. American families should not have to spend down their savings or assets to access long-term care. In my time in Congress, I've worked hard to expand access to affordable quality health care for all. And the Class Act, if it could be fixed, could properly help us to further that goal. It's clear that the Class Act is not perfect. HHS has acted to withhold action on that legislation until such time as it does become workable. And I believe that strongly that we can find a way to make this program work or to modify the program so that it will work. And I hope that my colleagues on the other side of the aisle will work with me to ensure that affordable long-term care is available for anyone who needs it. I ask my colleagues to join in working together on this problem instead of repealing legislation which does address a problem of great importance to the American people. I thank you for the recognition and the kindness. I yield back to Mel.
Chair, thanks, gentlemen, and recognize the gentleman from Michigan, Mr. Rogers, for 2 minutes.
Great. Thank you, Mr. Chairman. It's a sad day that we had to even get here because of the sheer fact that the CARE Act is not being able to be implemented because it just doesn't work. And this pride of authorship on this particular bill is killing America, just in my district. My family physician, who's taken care of my family for years, has announced that he's going down to 3 days a week because he will not take patients and lose money under the new Medicare provisions under the Health Care Act that was passed by this committee last year. Other doctors in my particular district have said that they're going to take 1 appointment a week now on Medicare. And they're doing this now so that they can prepare for the law as it comes. 1 slot a week for Medicare patients. So seniors are calling in tears, wondering where they're going to get care in the future. We have several practices are selling their several groups of doctors selling their practices today to hospitals to try to get out of what is a loser financially to see Medicare patients. I have another set of doctors who have told me that they will take no new Medicare patients starting next year. This is a catastrophe that is on its way to ruin America. And it's this pride of authorship that my friends on the other side of the aisle can't shake themselves from that will allow this to happen. This uncertainty is costing jobs in the economy, and it is spreading fear amongst our seniors, and doctors are walking away from providing services in this country. And it's happening today. It's not hypothetical. It's not going to happen. It's not something we're speculating about. It is happening today. And this, what we're going to do today, is just the symptom of a disease that will kill America. Thank you, Mr. Chairman, for your time in taking up this important piece of legislation so we can once again reanalyze how dangerous their health care bill is to the health of America.
Chair, thanks, gentlemen. Recognize the gentlelady from California, Ms. Capps, for 2 minutes.
Thank you, Mr. Chairman. You know, the issue of long-term care as a critical whole in our healthcare system is agreed upon by both sides of this committee. In addition, we know that the cost of long-term care is a critical component of any attempt to bring down our nation's healthcare costs and is key to getting our nation's fiscal house in order. The cost of long-term care bankrupts many families, but it is also costing taxpayers billions at the federal, the state, and the local levels. The private market is out of reach for most Americans, and instead many hold out for as long as they can before falling into the Medicaid social safety net that can't handle the strain itself. The Class Act was an attempt to address this problem by protecting more Americans against the cost of long-term care. And while the effort as written did not allow for the flexibility to align the program's benefits and structures, we just simply can't walk away from the issue. Instead, I believe we should use the existing law as a framework upon which we can build a sustainable program. The problem does not go away with Class Act repeal, but some paths to a solution do. I believe we need all options on the table, including options to fix the Class Act, to help families deal with the ever-growing problem of paying for long-term care. I want to work with my colleagues, Democratic and Republican, to find that path forward. So I encourage my colleagues to vote against H.R. 1173 and instead for this committee to spend its time doing all we can to help our nation's elderly, persons with disabilities, and caregivers get the long-term care relief they need and deserve. And I yield back.
Chair thanks the gentlelady and recognize the Vice Chairman of the Subcommittee, Dr. Burgess, for 2 minutes.
And, Mr. Chairman, with your permission, I'd like to yield my time to the co-author of the legislation before us, Dr. Gingrey.
Mr. Chairman, thank you, and Mr. Vice Chairman, thank you for yielding your time in the queue to me. Mr. Chairman, CBO Director Doug Elmendorf, in response to a question that I put to him back in March of this year, wrote that, and I quote, "The Secretary of HHS has now concluded that the class program cannot be operated without mandatory participation so as to ensure its solvency." End of her quote. To paraphrase, the CBO Director said that class cannot work without the Obama administration forcing every working American to buy this government insurance product. To my colleagues that oppose repeal, I have just one question. Do you support forcing every working American to buy government insurance? That's the core question that we're here to decide today, because absent President Obama forcing every American worker to buy long-term care insurance, the class program simply will not work. Mr. Chairman, there were a few ideas that HHS considered when trying to make the program work. For instance, page 39 of the Obama administration's class report mentions imposing a 15-year waiting period for the receipt of benefits on patients, quote, with pre-existing conditions, unquote. Page 40 of the report cites a proposal to provide a very low benefit amount to patients in the first 20 years of enrollment and only qualify for the $50 per day benefit after 2 decades. In addition, the former class actuary told the Associated Press that the program could be made solvent if the government marketed the plan only to groups of primarily healthy people first, or by requiring those in poor health to wait longer before they could receive benefits. Mr. Chairman, I, for one, will be voting today against forcing Americans to buy any health insurance program, especially from a bankrupt government, against imposing a 15-year waiting period on sick patients, and against a program that gives priority to healthy patients over sick patients. The Class Act is bad public policy. It's a fiscal nightmare that threatens the livelihood of every taxpayer. And so I do urge my colleagues, support H.R. 1173 and repeal the Class Act. And I yield back.
Chair, thanks, gentlemen. Recognize the gentlelady from Illinois, Ms. Schakowsky, for 2 minutes.
Thank you. Thank you, Mr. Chairman. I just want to first respond to my friend, and he is my friend, Mr. Rogers, who was talking about Medicare. I do want to remind everyone that it was the Republicans who voted to end Medicare as we know it, to end the central idea of a guaranteed benefit that older Americans will have, and setting them loose on the not so loving arms of the insurance industry to be able to provide health care for them. And it also is important to remember that when the Democrats were in charge last session, we passed a permanent fix for the doctor payment, so that there would be assurance that the doctors would get an adequate benefit from Medicare from their Medicare patients. So, but let me address now, for the minute I have left, on the Class Act. We all agree that there is a need for long-term care in this country. And what I've heard from both sides of the aisle is that we need to come up with a plan. So let's come up with a plan. There's an admission that the Class Act is not perfect. We don't disagree with that at all. But why is there such a compelling reason to get rid of the entire framework? Let's sit down with what is there, work together. I agree with the Chairman Emeritus that we can, with this framework, but with changes, make something happen. I agree with Mr. Towns, who called on our colleagues across the aisle. We have always worked together in this committee. That is the history of this committee. So rather than throwing stones at each other about the Class Act, let's sit down and figure out how we can help to make it work. You know, we're talking about a long-term care crisis in this country. The American people can't wait. They can't pay $70,000 a year for long-term care. So let's fix it together. I yield back.
Chair thanks the gentlelady and recognizes the gentlelady from Tennessee, Ms. Blackburn, for 2 minutes.
Thank you, Mr. Chairman. I am so pleased to co-sponsor the bill that's in front of us. And as we discuss it today, I want to remind my colleagues that repeatedly, as we have had this debate on Obamacare here in this committee, I have asked the administration, I've asked the Secretary of HHS if they have any example where all of these near-term expenses have yielded a long-term savings. And unfortunately, for their arguments in favor of government-run systems, they've never been able to give an example where they actually yield a long-term savings. Indeed, in our state of Tennessee, we certainly did not see a savings come from TennCare. What we saw was the cost increased, even quadrupling within a few years. What we do know is that less regulation, less litigation, less taxation in the healthcare arena is going to yield more personal choices for our constituents. That is what they want. What we also know is that currently the impending imposition of Obamacare is increasing the cost of health insurance and of health care delivery, and it is limiting access in our communities. We see this regularly. We also know that what government gives, government can dictate how much you're going to get, and it can also take it away. Our seniors deserve better than that. They also deserve better than the vote our colleagues across the aisle took when they agreed to cut $600 billion out of Medicare over a 10-year period and use it to help stand up the Obamacare program. Our goal is to increase access to affordable health care for all Americans. I want to thank my colleagues for continuing to work toward that goal, and I look forward to the passage of H.R. 1173. Yield back.
Chair thanks, gentlelady. Recognize the gentleman from Georgia, Dr. Gingrey, for 2 minutes for opening statement.
Mr. Chairman, I will yield my time to the Vice Chairman of the Subcommittee, Dr. Burgess from Texas.
And I thank the gentleman for yielding. You know, it's interesting this morning we've heard statements like we need to work on problems before we pass legislation. You know, it would have been great before we passed the Class Act. The last hearing we had on long-term care was actually under Chairman Barton's tenure, May 17, 2006. We didn't have a single hearing on long-term care or long-term care insurance during the run-up to the passage of the Affordable Care Act. Instead, at 11 o'clock at night, we got placeholder language dropped in the bill that passed out of this committee onto the floor of the House. So, yeah, it would be great if we could have some hearings. And in fact, we've had 2 hearings this year on the repeal of the Class Act. You know, we're finding more and more as the whole Affordable Care Act is called into question at the Supreme Court. how many of these dominoes are going to fall? We had a poor process, an irresponsible policy passed with rapidity. It's sort of like the we can't wait agenda for health care. And we've always suspected that this program was structured so that it could not be properly paid for and it eventually would fall into insolvency. And now we see from emails from that have been discovered by the committee, we see that that is true. And it really can't come as a surprise. And that's, I guess, what's so striking about these statements this morning. The complaints about the insolvency came from both sides of the aisle, as well as documents obtained by the committee and from the administration's own staff. And it will be hard. It'll be a hard lesson, but the taxpayer has already paid for this lesson, and the least we can do is try to learn. To do otherwise is an insult to the taxpayer. The fact is, the Class Act cannot be fixed. It will not deliver on the deficit reductions or the services promised, and until repealed, it remains an unacceptable, silent threat to both the Treasury and the efforts to do good work on long-term care issues overall. I thank the chairman for holding this, and I'll yield back the balance of my time.
Chair thanks, gentlemen. Recognize the gentleman from Ohio, Mr. Latta, for 2 minutes.
Thank you, Mr. Chairman, and thank you for holding the markup today on H.R. 1173, of which I am a co-sponsor. The subcommittee has held 2 hearings on the Class Act, and both showed loud and clear that the program is unsustainable and now needs full repeal. It is not enough that the administration has stated that they are suspending the program. The Class Act must be repealed in law. During the hearing on the program, it was revealed from the administration witnesses that the class program was unworkable, and yet the administration continued to plow ahead with implementation of the program for 19 months. In addition to the implementation, and therefore paying employees to work on this knowingly troubled program, the President requested $120 million in fiscal year 2012, with the bulk of the funds be used toward education and outreach efforts. During the March 17, 2011 hearing, Ms. Greenlee responded to one of my questions that $93.5 million be used for education outreach efforts for the class program, the program that the administration knew was unsustainable. While the current debt and deficit figures are staggering, the administration decided to request funds to continue marketing the Class Act, a broken product with taxpayer dollars. According to the CBO, the FY 2000 deficit was $1.3 trillion, and since President Obama has taken office, the debt has increased by $3.7 trillion, a 24% increase in federal spending, not including the $3.8 trillion outlined in the spending in his fiscal year 2012 budget. This is truly unsustainable, and it has to be stopped. I look forward to today's markup and supporting H.R. 1173 to fully repeal the Class Act, and I thank the chairman and yield back.
Chair thanks, gentlemen. Now recognize the gentlelady from Washington, Ms. Morris Rogers, for 2 minutes for her opening statement.
Thank you, Mr. Chairman. I don't have a statement at this time. Thanks.
All right. Are there any other members seeking recognition for opening statements? Chair reminds members that pursuant to committee rules, all members' opening statements will be made a part of the record. If there are no other opening statements, the chair calls up H.R. 1173 and asks the clerk to report.
H.R. 1173, a bill to repeal the class program.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. So ordered. Are there any bipartisan amendments to the bill? Are there any other amendments? If not, the question now occurs on I'm sorry? The chair recognizes the gentlelady from California for 5 minutes.
Mr. Chairman, I do move to strike the last word. You know, we've listened to statements made this morning by our colleagues, and I worry we are losing sight of the big picture issue at hand, and that is the serious long-term care crisis that this nation faces. As we all know, the statistics are sobering. Currently, 10 million Americans need long-term care. Over the next decade, an additional 5 million Americans will join this number. And the impact goes far beyond those who need care. Consider the countless hours of productivity that are lost by working family members who pick up the slack and rather than being productive at their workplace, become primary caregivers for our elderly or frail relatives. While nearly 2 million Americans currently reside in nursing homes or other institutions, the vast majority of Americans with long-term care needs remain in their homes with informal caregiving arrangements to help them get by. In fact, an estimated 52 million unpaid caregivers make it possible for their loved ones to stay out of nursing homes and hospitals. As anyone who's ever cared for a loved one knows, this is often an arduous task, even under the best of circumstances. I know this as a nurse and a mother. This is an extremely difficult role, and it's hard to do this role while continuing to do the other tasks that you might have. While the direct and indirect economic cost to the caregiver can be measured, the psychosocial toll is much harder to quantify. The vast majority of Americans who need long-term care are our seniors and people with disabilities. These individuals are among our most vulnerable, making it even more imperative to ensure that we have accessible and affordable ways to address their care needs. And the rest of us are just one accident or serious illness away from joining the ranks of those in need. Moreover, this issue is not going away. Instead, it will become, and it is becoming, a growing strain on our federal, our local, and our familial resources. As our nation continues to age, the demand for these important services will certainly grow. If we simply maintain the status quo, and we do that by repealing the Class Act, then Medicaid, which is the safety net program that has sort of by default become our long-term care system, Medicaid will no longer be able to handle this strain. It will crash. And isn't this also unsustainable? Mr. Chairman, as we debate whether or not to repeal the CLASS program, I urge my colleagues to keep in mind the staggering needs for long-term care we have now and will continue to face in the coming years. I'd ask us all to think of the ways that a reworked CLASS program could help their constituents and their family members. And I'd ask for a clear commitment from this subcommittee to work on this issue until we get it right. And with that, I yield back the balance of my time.
Sure. Thanks, gentlelady. Recognize the Vice Chairman of the subcommittee, Dr. Burgess, for 5 minutes.
Well, thank you, Mr. Chairman. I move to strike the requisite number of words. And we just heard some talk about the big picture and not losing sight of the problem. And that's exactly my concern with the Class Act as written. It wasn't going to work. It was never intended to work. It was a budget gimmick to allow the passage of the Patient Protection Affordable Care Act and to allow it to meet the goal, or the President to meet the goal, of expanding coverage while keeping the cost under $1 trillion. But now the problem has been unmasked, and this thing is going to cost $2 or $3 trillion. And, oh, by the way, the Class Act itself could never work, and the actuary at the Center for Medicare and Medicaid Services, Richard Foster, said as much in a memo in May of 2009, almost a year before the Affordable Care Act was passed into law. Now, I did a resolution of inquiry because I felt that information was withheld from Congress before we had the vote on the Affordable Care Act. But nevertheless, it has become clear over the hearings that we have had in this term of Congress that the Affordable Care Act, based upon a premise of the Class Act delivering dollars to the bottom line, was specious at the start. It was never going to happen. But the downside is then we've told people that, hey, you don't have to worry about long-term care insurance. And I've told this committee before, I have long-term care insurance because my mother told me to buy it years before I came to Congress. She said, you're getting old, and if you don't buy it now, you won't be able to afford it. And she was right. But we're anesthetizing people as to the necessity of having some type of coverage for long-term care. And we've put obstacles in their path. Companies that might otherwise develop products for long-term care insurance are saying now, well, we're not sure what the government is going to do, and this is a difficult enough landscape to play in anyway, and the government may, in fact, make it more difficult, so why would we invest our time and our resources into developing new and innovative products for covering long-term care insurance when we don't know what the Congress is going to do next? Certainly their track record in this regard is not all that commendable. Now, the reference was made to a crash of the Medicaid system. And I agree. The debt bomb that is going to go off in this country is going to be staggering and going to make everything that has been dealt with up to this point look like child's play. And this is baked into the cake. This is not one administration versus another. This is stuff that's already on a path to happen. But the cost to Medicaid of long-term care is going to be substantial. So why would we expand Medicaid to new populations when we already know we've got an unsustainable expense just over the horizon with the long-term care expense? Why would you say, I'm going to do a transformational change of the way health care is paid for and delivered in this country and expand Medicaid? Is that the best you can do? Expansion of Medicaid? And Medicaid, as we've already heard this morning, is under so much stress that it may not last. We took a bad problem and we made it much, much worse. Now, this committee does have a history of working together on problems like this. Back in 2005, I had legislation to expand what were called long-term care partnerships to more states. They were started as a demonstration project. They were limited to 4 states. These partnership programs will allow people who have used their long-term care insurance to then access the benefit under Medicaid if their benefits are exhausted, and they don't have to impoverish themselves to do so. Seemed like a pretty straightforward thing. It was working well in those 4 states that had allowed partnerships. So in the Deficit Reduction Act of 2005, that language was incorporated into the eventual passage of the Deficit Reduction Act. And again, that came from this committee, and that was a consequence of working together in a bipartisan fashion. I believe there are innovative things we can do to provide long-term care insurance to more people. The problem is we didn't go about it the right way over the last 4 years leading up to the passage of the Affordable Care Act. No meaningful hearings since May of 2006. We've had 2 hearings this year, but we had no hearings in the intervening 4 years. And then the language that became the Class Act was dropped into this committee at the 11th hour. And we were told, oh, well, don't worry about it. It's just placeholder language, and we'll let the Ways and Means Committee kind of fill in the details. No, that's wrong. We're the committee that should be working on that. And I hope going forward we are able to work on this in a bipartisan fashion. But the critical thing now is we've got to remove the Class Act as it exists, because it will continue to be a problem for private industry, to be sure, but certainly the administration as they go forward and try to fix the problems inherent in the Affordable Care Act. And I'll yield back 1 second.
Chair, thanks, gentlemen. For what purpose does the gentleman seek recognition? The chair recognizes the gentleman for 5 minutes.
Thank you, Mr. Chairman, and thank you, Mr. Dingell, too. I have to respond to Dr. Burgess because I know he's very principled, and there actually are times when we agree, but I can't agree with anything that he said today for several reasons. First of all, I want to dispute the notion that the Class Act was never, I'm using Dr. Burgess's words. He said the Class Act was never meant to work. It was a budget gimmick. Let me totally dispel that. This was something that Senator Kennedy had worked on long before I got involved. It was well-meaning. It was worked on with the disability community. It's really disrespectful, and I know that's not what you meant, Mike, but it is kind of disrespectful to the disabilities community and to the people like Senator Kennedy that worked on this for so many years to say that they never meant for it to work. We all understood, and if anything, Senator Kennedy was more realistic than anybody ever met. He understood that he had to do things in a way, had to have the right time, may have to pare things down, not get exactly what he wanted. But it was always his intention to try to come up with a program that would address long-term care, maybe not fully, but at least in part, and particularly with reference to trying to keep people in the community. So this was not a budget gimmick. This was not something that was never meant to work. It was fully intended to work. Secondly, the whole idea that the people involved in this are not taking responsibility, I don't know exactly what you meant, but you sort of suggested that somehow those who were involved in this in the Class Act were not taking personal responsibility. I mean, maybe that's not what you meant, but in any case, I want to assure you that that's just the opposite of what we intended. In other words, the whole idea was not to rely on the government, not to rely on Medicaid, or Medicare, but instead to have people, while they were working, put up a cash, establish a cash benefit that they were going to pay while they were working, and put into a trust fund that would be made available to them when they became disabled and had to go out and, modify their house or get somebody to come in and help them with personal care to stay in their home. It was very much a notion of personal responsibility and not relying on the government. So I want to dispel that as well. The other thing I want to dispel is, it's not that we don't believe that some on the other side of the aisle are well-intentioned, but Dr. Burgess used the term "we can't wait," which, the President has used now on numerous occasions. And let me follow up on that "we can't wait" theme. The fact of the matter is that people can't wait. We've heard the Republicans talk about, privatizing Social Security, using vouchers for Medicare, block granting Medicaid. We don't see proposals out there that, in my opinion, are realistically trying to solve the problem by keeping, these health care programs going. We see only Republican proposals that seek to repeal and tear down what's out there to help people. So, the fact of the matter is, Dr. Burgess, we can't wait. We've got the Class Act on the books. We don't want to repeal it. If you want to come up with some proposal within the existing framework to make this work, they are out there, and let's do it. Let's not just say, okay, we're going to repeal and we'll come up with something, a year down the road or 5 years down the road or 10 years down the road. The people are hurting now. They have a need for this, and we cannot wait. Now, I just want to say the Class Act is going to help adults who have or develop functional impairments to remain independent, employed, and stay a part of their community. It basically removes barriers to independence and choice. For example, you take the cash benefit for housing modifications, assisted technologies, personal assistance services, transportation that can be overwhelmingly costly. The idea is to prevent people. They take this cash benefit that they've been paying into themselves, they take the responsibility, and they avoid having to go to a nursing home or become a burden on the state because they stay in their house and they re-equip their house, or they have somebody come in and take care of them so they can remain independent. And that's what we're really asking for here. It's not going to solve all the problems with long-term care. I don't disagree with that, but at least it's a beginning. Because we know that 7 in 10 people are going to need some level of long-term care after turning 65, and in 1 in 20 are going to need 5 years or more of that type of care before they go to a nursing home. So let's make this work. That's all we're asking. Thank you, Mr. Chairman.
Chair thanks the gentleman, and now recognizes the gentleman from Georgia, Dr. Gingrey, for 5 minutes.
Mr. Chairman, thank you. I move to strike the requisite number of words. The argument that's being proffered by the Democrats on the committee in regard to I think that maybe the final statement of the gentleman from New Jersey, the ranking member, was let's leave it, that is the class program, let's leave it on the books. Look, I don't disagree with what the gentle lady from California, the nurse, Mrs. Capps, said in regard to the need to try to address this issue. And I don't disagree with much of what the gentleman from New Jersey said, but I do strongly disagree with them and my colleagues on the other side of the aisle who want to suggest that we need to leave this program on the book so that, I guess at some future date, maybe when the political atmosphere is a little bit better, that the program can be resurrected. I don't want to resurrect Dracula. I want to drive a stake through his heart. And that is really the danger of leaving the Class Act on the books. Let's take a little walk back in history. Maybe some of the members on the committee were here and understand it maybe a little better than I and would want to speak to this. But in 1988, an issue came up that could not wait, and that was to provide catastrophic care for our Medicare seniors. They just could not wait for Congress to pass that bill. And then when they found out what it was going to cost them in the way of increased premiums and insolvability of the entire Medicare program, they couldn't wait to see it struck from the law. In fact, I think they used their umbrellas to beat on the hood of the car of the chairman of the Ways and Means Committee at the time, Mr. Rostenkowski. So in 1988 it passed. 17 months later, that bill was not just simply set aside for a better day, it was stricken from the law. And let me just give you the vote count at the time for repeal of catastrophic care. 360 to 66 in the House of Representatives, 86 to 11 in the Senate, both bodies totally controlled by Democrats, Speaker Tom Foley at the time, Majority Leader George Mitchell. So think about that. You know, rushing to get something out the door leads to this kind of outcome. And we need to kill this bill. It's bad, and we don't want it resurrected. I don't disagree one bit with my colleagues who would suggest that maybe we need to form a bipartisan commission and study this thing and try to come up with the right formula for this long-term care problem and provide a benefit. But I sincerely believe that the free market can do that, but they're not going to do it with this bill still on the books, just waiting to be resurrected at some future date. They're not going to try to compete with that. So that's the reason why I feel so strongly we need to strike this sucker dead, and that's what this bill is all about. And with that, I'll be glad to yield to anybody else, or I yield back my time. I yield to the gentleman, my good friend from Illinois, Mr. Shimkus.
Yeah, just briefly, and I'm not going to pick on my friend Jan Schakowsky, his long history with that, and we're chuckling up here based on some of that story. But I would just say HHS was given the authority to look at the solvency of this program. And they tried 8 different plans to try to make it solvent at 75 years, from the basic plan to modified class plan option, enhanced plan with phased enrollment, family of options, modified class, temporary exclusion plan with phased enrollment, limited initial benefit plan with phased enrollment, prepaid benefit plan, you know, sometimes up to $3,000 a month in premiums. To our credit in the bill, HHS made the right call that this plan is not, you cannot actuarially make it sound. So get rid of it. We're just codifying that. Let's get a do-over. And a lot of, everybody knows this is an issue that has to be addressed. But in this way, shape, and form, it's not savable. And I yield back.
Chair thanks the gentleman. Does anyone seek recognition on this side? For what purpose does the gentlelady seek recognition? The gentlelady is recognized for 5 minutes.
I believe the Class Act provisions of the Affordable Care Act do mark a significant step forward in addressing the long-term care needs of all Americans. But the Class Act is especially important for the women of this country because long-term care is very much a woman's health issue. Women live longer than men. Their life expectancy exceeds those of men by some 5 years. And because they live longer, women are at a greater risk of needing long-term care services to help them when they become disabled or too sick or frail to care for themselves. Over 70% of nursing home residents and nearly 2/3 of home care users are women. Because women, far more than men, take on the role of caregiver, women are the ones who end up staying at home, sometimes giving up careers to provide care for a sick or disabled family member, adults and children alike. Indeed, women make up 3/4 of the home care workforce. Class would help make these challenges easier. It would provide the care women may require if and when they need long-term care or support for themselves. It would help provide relief, a break, if you will, for those women who spend all day, every day at home taking care of others in need of long-term care. To take away this program entirely is to take away the first real opportunity of the women of this country now will have to deal with the long-term care challenges they face day in and day out, both as patients and caregivers. And like so many other Republican assaults on the Affordable Care Act, H.R. 1173 is, in effect, an attack on women and women's health. Like all those other assaults, we should push back and reject this one. Class is just one of the many advancements for women's health that is included in the Affordable Care Act. The subcommittee should work to improve class rather than abandon the program's framework and leave nothing in its place. All the Republicans want to do right now, it seems, is to tear down this program, and they will get H.R. 1173 out of this committee. But what is offered instead? We've heard that it's unsustainable for Medicaid to continue to be the primary payer or long-term care services. And the private market, while it is another option, serves only a fraction of those who will need long-term care services. Congresswoman Capps reminded us all of the staggering numbers behind this issue. Democrats and Republicans alike agree that we need to do something about long-term care. Republicans agree that the status quo is not working. Congressman Cassidy summed it up best at our hearing last month when he said, quote, "Everybody agrees we need to come up with a solution for the problem of long-term care. I don't think any of us argue with that," unquote. Chairman Pitts made the same point at our earlier hearing on class. He said, quote, "I believe we can all agree that we do have a serious long-term problem in this country as the costs are driving people into bankruptcy and weighing down the Medicaid program. We do need to address the issue," unquote. And for Mr. Barton at the same hearing, quote, "Long-term care is a serious issue, and I believe myself and all Republicans are very willing to support some sort of program for long-term care, but it must be one which is sustainable and which is fiscally responsible," unquote. So this issue does seem to be bipartisan. But yet none of my Republican colleagues has presented a solution to the problem. I think we need to decide that we will work together to improve class. And clearly nothing else has been proposed in its place. In the words of Congressman Gingrey from last month's hearing, the only thing they want to do is, quote, "start over," unquote, in order to, quote, "get it right," unquote. And I disagree with that premise. We all agree that we have a major long-term crisis in this country. We also all agree that there is a law in place designed to address this problem. It is far from perfect, but it is a starting point. Where we disagree is where to go from here. And I believe we should stay the course, fix class, and move forward. Our Republican colleagues instead believe we should kill class. That's going to happen right now in this committee, it seems, in the subcommittee. And I think it's wrong to preserve the unfair, inadequate, and unsustainable status quo and move backward. I support a better future for our elderly and disabled Americans, and I oppose H.R. 1173, which simply repeals what we have already on the table instead of making a decision to work together to fix it. And I yield back. Thank you.
Chair thanks the gentlelady and recognize the gentleman, Mr. Rogers, for 5 minutes.
Would move to strike the requisite number of words, Mr. Chairman. Thank you very much. There's two ironies here. One, the Obama administration has said it is unworkable. It is a failure. It cost $83 billion more than was projected. Now, you could argue that that was just a miscalculation, or you could argue that that was a budget gimmick. Either one of those is the wrong answer. The second biggest irony about this is for all of the discussion from my friends on the other side of the aisle about how this is for seniors and we must do this for seniors, even though we've caused them more harm than we have good. In their bill, they cut $16 billion out of nursing home care over 10 years and $40 billion out of home health care in their bill to spend it on other programs. If you cared about seniors, then we better shake ourselves out of this pride of authorship and get back to taking care of seniors. This bill is hurting seniors today. So for all of our fawning of trying to help and protect seniors and somehow we're doing harm here, this is that first do no harm. We have got to get rid of this in the baseline or we're going to pay a horrible price for it down the road. This thing is dangerous. Their bill last year for Obamacare was dangerous, and the money that we took away from seniors was unconscionable. I yield back.
Chair thanks the gentleman. Chair recognizes Mr. Pallone for 5 minutes.
Thank you, Mr. Chairman. I look to my colleague on the other side there. Mr. Rogers, first of all, I would point out that when you passed your budget, which I opposed because it did make Medicare into a voucher and sought to block grant Medicaid, in fact, you adopted and voted for the changes to Medicare and Medicaid that were in the Obamacare or Affordable Care Act. So you guys are on record as supporting those changes, frankly, even though you now seem to suggest otherwise. Also, the President and the Secretary, or those representatives that were here to talk about the Class Act at the last hearing, didn't say that the Class Act was a failure. In fact, they said that they wanted to build on the Class Act and that there were ways of moving forward, and we're very much opposed to repeal. They actually, one of you actually asked a question, and the representative from the administration said they were opposed to repeal. But, you know, I wanted to get, I hate to, sometimes I don't like to evoke Senator Kennedy's legacy because I feel it's in some way I'm, you know, not worthy of talking about his legacy. But the fact of the matter is, and this kind of, when Jan Schakowsky spoke, she reminded me of this, is that, you know, the senator was looking to create a framework for long-term care. And once that framework was in place, his idea was it's a small step, but we can build on it. And if I don't think I'm wrong in saying that he also was the person actually that when you proposed Medicare Part D, actually went along with it because he thought it was a beginning and it was a framework for something that he could build on. And that's really what we're saying here today, which is, you know, when I opposed your Medicare Part D proposal because I thought that it was the wrong way to go and it had a lot of holes in it. But the fact of the matter is that when we were in the majority, we didn't seek to repeal it. We tried to improve upon it. And so what did we do? We had the problem with the donut hole, which I was very critical of, and we proposed filling the donut hole. So if you look at the Affordable Care Act, it actually phases out the donut hole over the life of the program. So I would say, you know, use the same principle here. Don't just repeal. You have a framework. Move forward with it. Try to come up with a way to improve it within the existing framework. And that is essentially what Senator Kennedy had in mind when he proposed the Class Act, and it's certainly what he had in mind when he advocated and voted for the Medicare Part D. I just don't understand the theory here that says you just, you know, throw everything out because it's not workable. In fact, there is a framework that is workable, and one of the things that I suggested, and we're working on an amendment that I'll introduce at the full committee, is that we ensure that the Independent Advisory Council is appointed and deliberates. And as I said in my opening statement, I think the expertise of this Advisory Council is critical to inform Congress and HHS about moving forward. So rather than repeal, let us move forward with this Advisory Council. Let's see if they can come up with a way of building on the existing framework. There's absolutely no reason to repeal now other than just because, you know, we don't like it, you know, nothing works, and let's just get rid of everything. It just makes no sense. I yield now to my colleague from California, Ms. Capps.
Thank you. Thank you for yielding, Mr. Pallone. And I actually just wanted to respond to the topic that Mr. Burgess brought up during his time of speaking when he talked about his mother, his wise mother giving him advice to purchase long-term health care insurance, which he did when it was affordable. When the younger you are, the less expensive it is to purchase. I know he would agree that not everyone has as wise a mother as he does. Not everyone can afford, even by signing up early, can afford long-term health insurance. And that's why the Affordable Care Act included the reauthorization of the National Clearinghouse on Long-Term Care, a nonpartisan, objective agency to provide answers to questions that many people have about how to go about this huge challenge that everyone is going to face at the end of their life. So I hope you're aware that this bill now, H.R. 1173, would deauthorize in Section B, Chapter 3 of H.R. 1173, the important program that gives unbiased long-term care information to people looking for ways to purchase this insurance. That program would be eliminated. I yield back.
Chair, thanks to the gentlelady. Is there anyone else seeking recognition? If not, the question now occurs on favorably reporting the bill to the full committee. All those in favor say aye. Aye. Those opposed, no. No. The ayes appear to have it. The ayes have it, and the bill is favorably reported. Without objection, staff is authorized to make technical and conforming changes to the bill approved by the subcommittee today. So ordered. The subcommittee stands adjourned.